Are you familiar with the nighttime indicators of diabetes? This query might not frequently occupy your thoughts, yet recognizing the symptoms of this widespread but grave medical issue can drastically alter outcomes. In this discussion, we delve into the discrete but noteworthy indicators of diabetes that commonly present themselves at night. These nocturnal signs provide crucial clues to possible underlying health issues. If you're experiencing any of the following symptoms, don't hesitate to reach out to us in the comments. To begin, an initial symptom. Increased nighttime urination. A common sign of diabetes is the need for more frequent urination, especially noticeable if you find your sleep interrupted multiple times to visit the bathroom. Such disturbances in your sleep routine could hint at diabetes. This condition arises as diabetes leads to a surplus of glucose in your blood, compelling your kidneys to work harder to filter and absorb the excess sugar. Should your kidneys falter, the additional glucose gets expelled in your urine, pulling along bodily fluids from your tissues, thereby elevating the frequency of urination. This natural mechanism aims to eliminate the excess glucose, serving as an early warning sign of diabetes. Additionally, experiencing night sweats. Night sweats is a vital symptom to be aware of. Waking up frequently to find yourself soaked in sweat might indicate diabetes. Often, night sweats are the result of low blood sugar levels during sleep, a condition termed nocturnal hypoglycemia. It triggers the release of emergency hormones to counter the low sugar levels, causing excessive sweating. Tweaking your medication or adjusting your diet can help manage night sweats for those with diabetes, but such changes should always be overseen by a healthcare professional. Before we introduce the next symptom, remember to like and subscribe. Moving on, indications of hypoglycemia. Indications of hypoglycemia encompass not only sweating and shaking, but also a pronounced increase in appetite, confusion, fuzzy vision, and even heart flutters, which can manifest during the night. Hypoglycemia, or diminished blood sugar, is frequently linked with diabetes. These symptoms predominantly emerge at night due to the body's energy requirements during rest. As blood sugar diminishes, the body signals these symptoms as a cry for a glucose replenishment. To manage these symptoms, it's essential to consistently monitor blood glucose and consume well-balanced meals. Additionally, it's vital to discuss with healthcare providers about any medications since certain prescriptions can influence blood sugar levels. In specific instances, a bedtime snack composed of complex carbohydrates and protein might be advised to maintain stable blood sugar levels overnight. Restless leg syndrome. The fourth indication we're discussing is restless leg syndrome, a neurological disorder that often doesn't get the attention it deserves, despite its prevalence. Characterized by an uncontrollable, powerful urge to move one's legs, this condition is accompanied by peculiar and uncomfortable sensations deep within the legs. These are sensations, challenging to articulate, have been compared to feelings of aching, tingling, or even a creepy-crawly experience. You might question the relationship between this syndrome and diabetes. The link primarily involves the nervous system. Chronic high blood sugar levels, a hallmark of diabetes, can inflict nerve damage over time. This nerve damage, known as peripheral neuropathy, frequently arises as a complication of diabetes and can trigger the development of restless leg syndrome. The impaired nerves may send confused signals to the brain, causing the feelings that lead to an incessant need to move the legs. Therefore, if you're encountering such discomfort or an overwhelming compulsion to move your legs, it could be beneficial to have your blood sugar levels evaluated. Sleep apnea exploration. The fifth topic on our list is the sleep disorder known as sleep apnea, characterized by recurring pauses in breathing during sleep. These interruptions, or apneas, can occur numerous times throughout the night, leading to fragmented sleep and often resulting in fatigue the following day. The link between sleep apnea and diabetes, particularly type 2 diabetes, is striking. Studies have shown that individuals with diabetes are at a significantly higher risk of experiencing sleep apnea. The reasons behind this are complex. A primary factor is that both conditions share a common risk element. Obesity. Excess fat, especially around the neck, can block the airway, causing sleep apnea. Additionally, the metabolic issues associated with diabetes, like insulin resistance, can directly foster the onset of sleep apnea. Insulin resistance may disrupt the body's energy utilization during sleep, causing breathing to stop and start. This intricate relationship underscores why people with diabetes may face a heightened risk of sleep apnea. Enhanced thirst and polydipsia. Progressing to the symptom of enhanced thirst or polydipsia, experiencing an unusual dryness of the mouth and an intense need to drink water, especially if it disrupts your sleep, is a clear indicator of diabetes. This condition arises when elevated blood sugar levels force the kidneys into overtime, trying to filter and absorb the surplus glucose. If the kidneys are overwhelmed, the extra sugar exits the body through urine, taking with it fluids from your tissues, which then increases urination and, subsequently, thirst. To manage this symptom effectively, maintaining balanced blood sugar levels is crucial. Regular monitoring, a nutritious diet, consistent physical activity, and following prescribed medications are advisable strategies. Always consult with a healthcare provider to determine the most effective management plan for your symptoms. Do not overlook persistent thirst, particularly when accompanied by other diabetes indicators, as it is a vital sign from your body alerting you to potential issues. Fatigue awareness. A crucial sign to be aware of is fatigue. If you consistently feel exhausted, even after getting a sufficient amount of sleep, it could be a signal of diabetes. Fatigue related to diabetes stems from the body's inefficiency in utilizing glucose for energy. When your body is unable to transform food into energy effectively, either due to insufficient insulin or insulin resistance, you may experience ongoing tiredness. This happens as the cells lack glucose, which is essential for their proper operation. Addressing diabetes-associated fatigue involves managing stable blood glucose levels, achievable through routine exercise, a nutritious diet, and regular appointments with your healthcare provider. Ensuring adequate rest and minimizing stress are also key in combating diabetes-related fatigue. Dry mouth considerations. Dry mouth, medically referred to as xerostomia, is another symptom to monitor closely. It's characterized by a lack of saliva, and individuals might often wake up feeling their mouth is particularly dry, even if they stay well hydrated. This condition could be indicative of diabetes, as high blood sugar levels can inhibit saliva production, leading to dry mouth. Furthermore, elevated glucose levels can enhance urination frequency, potentially causing dehydration and, in turn, a dry mouth. To manage this symptom, it's important to practice good oral hygiene, ensure you're adequately hydrated, and consider using saliva substitutes or stimulants as needed. Activities like chewing sugar-free gum or using sugar-free lozenges can also aid in stimulating saliva flow. Consulting with a healthcare professional is crucial for an accurate diagnosis and appropriate management of this condition. Sleep disturbances, insight understanding, sleep disruptions. A significant aspect to consider is the occurrence of sleep disturbances. Experiencing insomnia or other forms of nighttime unrest can often be associated with diabetes. Individuals with diabetes may encounter chronic sleep issues as a result of the body's challenges in maintaining stable blood sugar levels, which may lead to conditions like nighttime hypoglycemia, low blood sugar, or hyperglycemia, high blood sugar. Hypoglycemia can cause symptoms such as sweating and trembling, disturbing your sleep, whereas hyperglycemia can increase the need for urination, leading to frequent nocturnal bathroom visits. Addressing these sleep disturbances typically requires improved blood sugar control via medications, dietary adjustments, and physical activity. Additionally, Therapies such as cognitive behavioral therapy may offer relief for insomnia. Therefore, if sleep issues persist, it's crucial to explore the possibility of diabetes and seek professional healthcare advice for an accurate diagnosis and effective treatment plan. It's important to remember that while these symptoms can suggest the presence of diabetes, they are not conclusive evidence of the condition. They do, however, highlight the importance of seeking medical advice if you're experiencing one or more of these symptoms. Diabetes is a globally prevalent condition, and awareness of its signs, particularly those manifesting at night, is crucial for early detection and management. If you found this information helpful, don't forget to like and subscribe for more insightful content.